Good afternoon and welcome to the session on Cultivating Wellbeing, School Health and Nutrition for a Sustainable Future. It's the last session of the day, but if I'm biased, I would say the best, because it actually brings together all the things you've heard throughout the course of the day. And we have an amazing panel who's going to be joining me on stage, who's going to be helping us understand how all these different areas and topics that we've discussed today comes together in order to serve the child. I am Shariha Khalid. I'm a founding partner of Mission & Co. I'm a medical doctor also, and so this topic is extra special to me, very close to my heart. And I'm also a trained gastronomy enthusiast. I trained recently at the Le Cordon Bleu in Paris because I'm so invested in the topic of gastronomy, nutrition, and food trends, particularly working with children. So just to provide a context before I invite the panelists, can I just have an idea of who is in the room? Who here works with health programs in schools? So we've got about 4 hands there. And who covers nutrition? Who works with children in school? And what about children out of school? Great. Well, we're going to have a very engaging conversation because everyone who's in this room seems to be working directly in this area. So allow me now to invite our esteemed panelists, starting with Professor Donald Bundy. Professor Bundy is the director of the Research Consortium for School Health and Nutrition at the London School of Hygiene and Tropical Medicine. Don, will you please join me on stage? Thank you. And next is Caitlin Barron, CEO of Luminos Fund. Caitlin, please join me. Thank you. And next we have Cosmas, Ejong, and Ndellejong, Global Technical Lead for Schistosomiasis and Salt-Transmitted Helminthiasis at Sightsavers International. Cosmas, please.
Thank you. And
next we have Laura Parrotta, who is the Senior Director of Investor Relations at the End Fund. Please come and join me here, Laura. Thank you. And lastly, Jim Emerson, CEO of The Power of Nutrition.
Thank you.
Welcome. So before we begin, I'd love to just provide the context for our discussions today in terms of the critical role that health and nutrition plays in the educational and overall development of the child, of students. Now, we have growing concerns about childhood obesity, malnutrition, mental health issues, as well as, how can I say, the reduction in funding, that has happened during the time of the pandemic for school meals, particularly. And it's very important when we talk about the development of the child to remember that the first 1,000 days is critical, and that covers until around age 3, but then the next 7,000 days are equally important too. In addition to looking at that particular aspect of addressing the development of the child from birth until they leave school, one of the other things that we are also facing right now is the impact of climate change on the health of the person, especially children. Those most vulnerable are the ones most affected by climate change. And in that regard, we've also seen the emergence of new diseases that weren't there before. And ultimately, the school is an area where you could potentially deliver many programs, but then how do you actually address the child who does not attend school, who can't or does not attend school, and also children when they're still at home before they start at school? So we're going to be covering a few of these areas. We have in our panel those who have implemented programs in communities, in schools, and have worked with children from different backgrounds in the course of their work. And let's start our discussions with Professor Bundy. Dawn, we all know how important the first 1,000 days of life are, but what is the justification for the new focus for the next 7,000 days? Because this is a new thing that's emerging now beyond the 1,000 days. Thank you.
Great, thank you very much, Shariha. That's it's a great question, and I like the way you put it, because there's no question about the importance of the first 1,000 days. I don't think there's any dispute around that at all. And it's 1,000 days meaning in mum. I mean, it's the first, the in utero development, and then neonatal and infant, all of these absolutely crucial foundation for life. There's no question about that. And of course, for many people in the population, often referred to as parents, there's no question that you need to continue looking after the children as they grow up. But it's been us in the health business that have not been too clear on this. And the issue here is about a young person achieving their full potential during the time they're growing up to become an adult. That's actually the issue. So there's no question about the need for the early foundation. The issue is about what happens then. Because when does somebody become an adult? Well, modern analysis around adulthood in a physiological sense suggests it's 27, 28 years of age. I mean, even our sociological belief is it's 18 or 21. That's when we have these fancy birthday parties, right? But it's certainly into the 20s. If you speak to insurance people, they won't insure, particularly boys, to hire cars. I shouldn't call boys 25. They won't insure 25-year-old men to hire cars, for example, at least not for reasonable amounts, because it's still a process of development, and most of the physiological studies are very clear on this, that physiological development carries on right through to the late 20s, and then really stabilizes through into the 60s. That's when you're an adult, and that's, if we were world bankers, we would talk about human capital. That's when people serve as adults in terms of supporting their communities. Well, we've been historically thinking, well, after the first 1,000 days, we kind of leave people alone. But the evidence now is as I said it, and last year the National Institutes of Health group set up a thing called the Bond Kids Project, kids meaning young people rather than infants. and they followed this through. They said, well, there's puberty in this phase of life. There's adolescence in this phase of life. The most important period for brain development is actually late adolescence. Why is it we don't think that we need to care about children during that phase? And we've got the head of education from the World Bank just joined us, so that's very timely. Then these children also, these are the young people that we already invest very substantial amounts of money in for educating. Do we not think that the well-being of those learners might be relevant to their learning? So I'm just trying to put forward the issue. So we're saying secure the early gains of the 1,000 days, but you need to support children through these vulnerable phases until they become adults. You need to support them to leverage the investment in education. Why don't we do this? We just recently started looking at publication effort by age of young person, 0 to 20 years of age. Only 10% of all the world's publications on the health of young people are on young people between 5 and 15. Nearly all of them are under 5, then there's another set that's sort of older adolescents. But the group we actually educate most are the group we don't seem to look at their health at all.
That is really surprising, and clearly that's something that needs to be addressed, because that is basically the age range when they go to school.
Yeah.
And when they go through puberty and all the kind of life changes too. Let's move into school and nutrition in the context of that. You know, the data is in school meals make sense. And of course, there's a moral imperative too of feeding hungry children. Furthermore, school meals drive attendance, establish the preconditions for learning, and also creates a sense of purpose for the child. Like, you know, I go to school to be able to eat. You know, sometimes if we kind of think about the child, they don't often think that, you know, the school meals is there as a program. They see it as, it's where I'm going to get my meal for the day. Right, Caitlin, you work very much in this area. The Luminos Fund is doing quite a lot already, working across, you know, with 250,000 children and many, many partners around the world. What has been your specific experience in delivering school meals at that operational level, and what sort of last mile challenges have you encountered in doing so, and how have you overcome them?
Well, thanks so much for the great question, Shariha. And you're absolutely right. You know, school meals are, in a sense, a no-brainer. What's not a no-brainer, though, is delivering school meals. And it's one of these classic examples of we have the data that tells us clearly this is an investment that pays off. It's estimated every dollar spent on school meals delivers a $9 return, right? And we know from the data that school meals drive up enrollment by as much as 9% and attendance by 8% as well. And in our work at Luminos, we've seen that firsthand in our program. We have children with us for an extended day doing intensive catch-up education. And there's quite frankly just simply no way that a child could be in a classroom for 7 or 8 hours a day without having a good solid meal in the middle of that. The challenge is in the logistics, right? And here's where the devil is in the details, right? Deliver too much food to a given site, and you risk diversion of food and fraud. Deliver too little food, and children go hungry. Deliver food that sounds like a nutritional win, and you've ticked a good box, but should that food be less than tasty or less than what the child is looking for, you wind up with a whole bunch of uneaten food at the end of the week. And it's not just a one-way delivery process, right? Without robust checkup systems, without having staff on the front lines actually interviewing children on an ongoing basis. Have you eaten your meal today? Yes, no. You find that so many children can fall through the cracks. And we see that today. There's been really great work expanding school meals the world over. There's still 73 million children around the world who desperately need access to school meals, who miss out.
Thank you so much for also sharing the statistics. It's really shocking to know that there's so many children who are still going to school hungry. I wanted to take a moment to acknowledge we have recently been joined by 2 kids. Hi. How old are you guys?
I'm 13. She's 9.
9 and 13. Thank you for being part of this session. We really love the fact that you are here, because, you know, we are adults trying very hard to solve this problem, and we really need to work more with children like you. I wanted, just on the note of what you shared, Caitlin, I recently did a project with 50 kids from 20 countries, asking them what would they like to eat in their school meal. And 35 of them contributed recipes. And that was amazing to see that they were just so keen on sharing what they actually wanted to eat at school. and saw a role that they could play in terms of influencing perhaps what they're being fed. But putting on now my kind of investor financier hat, the returns you're mentioning, for every dollar, $9 in return. That's amazing. If we package this as a product that we put out to the market, this is really amazing. So we will get into... Oops.
Sorry.
Are you all right? We will get into the discussion about financing and resourcing programs such as the school meals. But first, I'd love to hear from another person who's very much on the ground, implementing school health programs, Cosmas. What do you foresee as the biggest challenge facing school health programs from your work, and you know, what are the potential mitigation measures that you suggest?
Thanks, Shariha. I think the biggest challenge we face with school health programs is sustainability. There is a lot of investment from donors, but that investment has to be complemented with policy actions and also domestic funding. And if the investments are not made in such a way that the systems in which we deliver are strengthened, then in the long term we may risk not achieving our sustainable goals. Because policy action definitely that are directed to, for example, the health and the school system, you know, it would transfer not only competencies within that environment, but have a long-term impact on children as they develop over time. We ran the school health integrated programming in Liberia, where we trained teachers on how to conduct visual screening, and also train them on how to conduct deworming. And we saw an amazing result, like when a child have difficulties to concentrate because, you know, visual impairment conditions, when glasses are offered, the results actually show that the learning outcomes improve significantly. So when you have this kind of programs that are integrated and owned and sustained by the government, it makes a huge difference. And that's what we are trying to promote, that these investments that are coming should also be complemented by corresponding government actions.
Yes, indeed. That ownership is actually critical, because that's also going to encourage unlocking resources from national sources rather than a reliance on donor funding.
Yeah.
I wanted you to just expand a little bit on what else you're doing in health and education, how you're using this integrated approach, just so the audience also understands what this means in practice, please.
Yeah, in practice, in education, we focus mainly on inclusive education, because that's a section that is also requires very special attention. Children with special needs, when you enroll them in mainstream schools, if the teachers are not properly trained on how to cater for those special needs, first you have a problem with their development, especially during those formative years. Secondly, there is a risk of dropout, because they'll struggle not only to understand the lectures, but also to get themselves integrated into the environment where they study. We have such programs in 14 countries in Asia and Sub-Saharan Africa.
Thank you. Indeed, you know, we talk very much, and this whole COP 28 is also very much focused on inclusion, but, you know, we've really got to have that intentionality in how we're doing our programming so that it is inclusive, looking at the child who has many different abilities, but also to include children who might not necessarily be registered as being of a particular state.
Sure.
I come from Malaysia, and we have a huge issue with the stateless child. Anyhow, it's in a little bit a segue also to what I'd love to ask Jim. We've been very much focused on schools, and I want us to talk a little bit about what happens in the years before school. We know that primary education is, a key for, how can I say, a key building block for the development of the child. And you particularly right now, through the power of nutrition, focus on early childhood development. This focus on the early years of the child is important. But equally, you have seen that it does not benefit from the same level of investment as what we see in formal education, both primary and secondary. So in your experience, Jim, what are the implications when the early years are not given the right level of attention and investment?
Thank you. Let me step back a little bit, first of all. And we heard this morning at the opening ceremony about the importance of education in tackling the climate crisis. And we all know already that it's a key factor in overall development, societal development, and the development of human capital of the individuals in every country. And we also know that the UN Convention on the Rights of the Child has made it mandatory to have free primary education for all children. But the Convention on the Rights of the Child doesn't say a great deal about early childhood development. It mentions that it is the responsibility, Article 18 I think it is, it's the responsibility of parents or guardians to provide early childhood education, early childhood development opportunities for their children. And that, I think, is what is a key factor in why it's often neglected. So it is once you've ratified your Convention of the Rights of the Child at the national level, then you are mandated to provide free and compulsory education, primary education for all children. We don't have it. Even in the rich countries, we don't have the level of investment, we don't have the commitment to early childhood development. The Power of Nutrition works to provide sustainable maternal and child nutrition solutions at scale across Africa and Asia. And we focus on the most vulnerable. We don't want any child to fail to reach their potential, as has been mentioned by several panelists here, because of poor nutrition. And yet we know that is the case for many, many children, that as a result of stunting or wasting, they are not able to reach their full potential. And it's particularly important in the early years of the life, the first 1,000 days, but also going beyond that, as Professor Bundy was saying, particularly up to 2 years, 2, 3, 4, 5 years of age. The impact, which was the question you're asking, just a few facts about that. So malnutrition contributes to nearly half of under 5 deaths in the world. And that's a huge number. So it's not the main cause, it's not the direct cause, but it certainly contributes to the deaths of children. It affects 1 in 3 children. Nearly 4 in 10 children in sub-Saharan Africa and Asia suffer from stunting. We know that stunting affects not just the physical development of the child and the height, but it also affects their cognitive development. And as a result, they are 12% less likely to be able to write a complete sentence by the time they reach 8 years old. We also know that well-nourished children are 33% more likely to have a better livelihood, to have a better job, and to escape from poverty. And at a national level, results of a survey done show that stunting costs the private sector over $250 billion annually. So there's a great need to invest in this whole thing. So to address this, we are increasingly supporting early childhood development centres. A lot of early childhood development takes place in the home, but by supporting development centres, focusing on the first 1,000 days, the centres can play a real vital role in building a foundation for children's long-term health and well-being. By providing nutritious meals in the centre, In some of the centres that we work in, it's 2 meals. It's a breakfast in the morning and a lunchtime meal, often with food which is locally produced in school gardens, helping the local economy and getting children to learn a little bit more about the food and where it comes from, so that they can develop both mentally and physically before they start school. And we know that when we do nutrition along with education, so nutrition combined, good nutrition combined with education, addresses multiple dimensions of child development. And it's actually one of the best ways to transform a child's physical health, education, livelihood. And in the context of today's global food crisis and the impact of climate change, investment in nutrition and ECD is increasingly urgent. But it's chronically underfunded. ECD is chronically underfunded, receiving less than 1% of national budgets.
And Jim, what is the annual need?
That's what I was just coming to. So the financing, the gap in funding and need is growing.
I'm also trying to remind you of it.
And the additional, we need an additional $10.8 billion every year if we want to achieve our nutritional goals by 2030. So that's a huge need. We really need to commit to that.
10.8, 11 billion.
That's right.
Shortfall.
Yeah.
To deliver for how many children?
Well, that's to all of the to wipe it out. So SDG 2 is addressing hunger and malnutrition for all children. So.
Right.
Yeah.
Okay. Wow, staggering numbers. There was a little glimmer of hope with an expansion announcement. I was here for the Health Day announcement for reaching the last mile fund of $777 million. And I know that Laura, your organization, the End Fund, was involved in that too. Obviously, it's just a tip of the iceberg when we're talking about, just in the area of ECD, you're addressing 11 billion shortfall. I mean, that's not even covering school meals. I think school meals, how much is missing, Caitlin, in terms of what's needed?
Well, there's 74 million children who are not yet getting the meals they need. Yeah.
I mean, the numbers are staggering, but let's work with what we do have and help us better understand with this expansion, Laura. We know that over 1 billion children are at risk for parasitic worm infections. And why is deworming important in the context of the conversation we're having today? It's because, it also impacts directly the health of the child and how they're going to be able to absorb any nutrition that they, take in. So tell me, or tell us, Laura, you work very much, the End Fund works very much in this area, in deworming programs, and we know these diseases pose a significant risk to the child's overall well-being. But why should we, or what are the potential impacts of deworming on cultivating child, health and well-being? Help us better understand, please.
Yeah, absolutely, and thank you for that question. And to me, the most important thing is really, if you have to remember one thing, is that deworming, about 1 billion children are in need of deworming. And for neglected tropical diseases in general, I'm going to refer to them as NTDs because it's a bit of a mouthful. But for context, NTDs are a group of parasitic and bacterial infections that affect the world's most impoverished population. And the End Fund is a private philanthropic initiative that was created to tackle NTDs through a tailored investment approach and aimed at accelerating the elimination of those diseases. So even though we are doing treatment, the end goal, am I doing this? They had to stick it in the earring, otherwise it would fall. But let's focus. Can you still hear me? Okay. So yes, through a tailored investment approach, but aimed at accelerating the elimination of those diseases. Because even though we are doing treatment, it's not working. Even though we are doing treatment, yeah, that would be better. Yes. Thank you. Can I go? Okay. Yes, so we are doing treatment, but the end goal is really to eliminate those diseases because we know it is possible and it's been done before. But yes, our work includes deworming, which is the administration of medication to eliminate worms within the human body. And these worms, we're talking about intestinal worms and schistosomiasis, they cause a range of issues that directly impact children's wellness. But thankfully, deworming helps address some of those issues. The first one being, and I'm going to be looking at you, Jim, not only does deworming improve health, it also improves nutrition. And we know that because we work together on some of those programs.
That's right.
And that's because parasitic infections lead to malnutrition, stunted growth, and anemia in children, all the things that Jim mentioned earlier. They're still the nutrients that children need in order to grow and develop properly. And in addition to nutrition, worm infection compromises the immune system and can lead to additional infections. So by reducing the burden of diseases, children are more likely to experience improved overall health and nutrition. Second, deworming improves cognitive development. We also know that parasitic infection impact cognitive development and affect learning capacity and educational outcomes. And there's actually been some research on that topic by economist and Nobel Prize winner Michael Kramer. And the research shown that school-based deworming improves not only health, but school attendance by about 25%. And lastly, deworming produces economic benefits in the long term. Because healthy children are more likely to attend school and remain in school, they have a greater chance of eventually contributing to the workforce. And again, Kramer's study, a follow-up to this study, looked at boys who were dewormed, who were part of deworming programs as children, and actually were more likely, they find that they were more likely to end up in higher paid jobs versus their peers who did not benefit from deworming programs. So we know that eliminating parasitic worms also can boost economies. And I'll just end by saying that the impact of deworming is not only on children's health today, but it's also about their future as productive members of society with higher educational outcomes and economic power.
Thank you. And I'm glad that we're actually addressing that topic in the context of, economic development of a nation, rather than just talking about, okay, here's some challenges that need to be addressed. Here are the programs that are addressing them. We really need to make the business case for why investing in a child and the child as a whole and that child's development from the beginning until they are adults. I mean, this is great that you mentioned that actually even until 60. When are we actually adults then? And when do we...
Exit.
Still growing. We're still growing.
Can I just say something on this, exactly on this deworming thing? So Michael Kramer's work is in Kenya, and there's a cohort there. It's more than 20 years now. Oh, sorry, a cohort of young people who've been followed for more than 20 years now. Some who were dewormed and some who weren't. So this is not theoretically they'll have more earnings. They do have more earnings because you know how much they're earning, right? I mean, they're actually there. But here's Michael's what I thought was a really wonderful outcome. So they earn more. So they have a bigger salary. It's in Kenya. And in Kenya, people do pay taxes. And actually, the taxes on the extra aliquot of salary that they're earning are quite sufficient to pay for the treatment they had 20 years previously. I just love the symmetry of that. So it's not only, I mean, that in a funny way, of course, they're paying more tax as a result. But the reality is the tax alone will cover the cost of these. I mean, deworming pills are very trivial in price, but it's such a nice economic example.
Yes, and it's a perfect. It's 50 cents per person per year.
Up to, depending on the country, it can vary, but it's up to 50 cents per child per year.
That's nothing.
And Jim can give lots of examples of things that are just as cheap. Yeah.
Yeah, but we need to get these numbers out. I particularly love the connection to how the cost of not investing in a child's nutrition, if they were stunted, can actually impact the private sector too, costing them, what was it, the numbers, 250 billion. You've got
250 million.
to send me that paper, because I work a lot with the private sector, and they're always more convinced when they see the business case for doing things. Now, coming back, we don't have so much time left. We've got just a few more minutes, really, before we have to move into the next room for the closing ceremony. But I don't want us to leave without addressing that very bit of the resourcing of all these wonderful programs that need to happen on the ground. You know, and we know very much, for example, in the context of school meals. I know, Dawn, you wrote a wonderful paper recently, which you just launched just before this session, on that white paper on could you flash it a bit there? We won't have so much time to talk about it, but is this going to be available online? It's called School Meals and Food Systems, Rethinking the Consequences for Climate, Environment, Biodiversity and Food Sovereignty. And I've had a sneak preview of it. It's really wonderful. Because it brings together, you know, the things we're talking about, climate impact, as well as the investment case that's needed. Let's finish off our discussion today by hearing about, you know, what else can we do? Perhaps, Caitlin, could you just get us started? Because, you know, you were talking about the shortfall in funding that's needed for school meals program, but what more can donors do to ensure that every learner gets a square meal a day?
I mean, I think there's two things we'd encourage funders to think about. One is be thoughtful about the children who are not in school, who you're not reaching. And today there's still 1 in 10 children around the world who miss out on primary school. And where we work in West Africa, that number is actually 1 in 3. So if you're thinking about reaching the children of a nation, think about reaching every child. And that means working thoughtfully with children who are out of school as well as in school. The other thought we'd recommend is that coordination and alignment of different programs is a real possible solution here. So, for example, in our work in Liberia, we've co-located with Mary's Meals, a school-based feeding service, such that their intervention together with our education intervention can really mutually reinforce each other. I mean, that's a huge win when that works. It's the classic kind of thing, though, that seems easy in theory and can be tricky in practice. And so having funders who are willing to provide flexible funding and more flexible time horizons to allow for those kinds of collaborations to come together can really unlock transformative opportunities for kids. It takes a little time, a little patience, a little more flexibility than maybe we're always ready to accord. But when we loosen up the system just that little bit, it's extraordinary what organizations can come together to do.
And I think it's also important to demonstrate that you can work in the context of programs with multiple types of funders. You know, on the one end, I often speak about the spectrum of capital. You know, on the one end, you could work with funders who are only interested in donations, philanthropy, but don't forget that you could also work to unlock resources from those who are seeking returns and risk capital on the other end of the spectrum. It's just about how you structure, you know, programs and financing instruments to be able to address the different types of funders who are out there. Laura, you obviously as a funder, you also bring about this multi-stakeholder collaboration approach around funding, you know, resource mobilization. Can you share a little bit about some things you have done, some examples that illustrate how this has been successful, please? And just in 1 minute, I am just mindful.
I'll grab your mic then. I'd say the most important thing in order to be efficient is really think about cross-sector collaboration. I quickly touched on the work that Power of Nutrition and the N Fund do together in Ethiopia. And to Caitlin's point, this particular program is about preschool children. Because they're not going to school, they were not getting the deworming pills that they needed. So when we partnered with Power of Nutrition, we used their nutrition program to reach preschool children, and at the same time, making the nutrition program more efficient with deworming pills. So think about cross-sector collaboration. We do the same with the WASH sector because that allows us to go beyond treatment and into prevention, where you really teach people about hand washing, and you encourage people to use latrines, build latrines. And same with the education sector. The deworming happens in partnership with ministries of health. So it's the Ministry of Health and the Ministry of Education working together on those programs. So yes, cross-sector collaboration, whether it's with ministries, the private sector, funders.
Thank you. And I'm currently working, my nonprofit, I also have a nonprofit, and we're working with the Ministry of Education in Malaysia to actually make schools happy environments. It's actually a program of UNESCO called the Happy Schools. So you actually look at happiness as the end goal and you know, all the different things that you need in order to achieve happiness. Just in a few words from each of you as we close, you know, what would you like us as an audience, as listeners, as speakers on this panel to walk away with from this session? Shall we start with those closest to me? Or maybe, Jim, why don't you start us off, please? Something to remember, something, you know, for us to act on beyond the walls of this summit, please.
Well, I'd like to remember that resourcing challenge that we've discussed already, so the massive gap in the funding for nutrition programs, but also recognize that gap can be filled in various ways, and we will probably, us at our level, be focusing on the big corporates, multilaterals, bilaterals, philanthropists to be able to raise those funds. But let's not forget that a huge amount of resources comes from within the family, within the community, and in particular the storage of food, the cooking of food to make it more nutritious, and the reduction in the waste from food can go a long way in addressing some of the issues that we face in terms of nutrition.
Excellent. So we mustn't forget who else we should be collaborating with, and that starts with the communities too, not just the usual suspects.
Absolutely.
Thank you. Laura?
I would absolutely echo what Jim's just said, working on the ground with the community, trusting them to know what's good for their own community. And I think that's part of the collaboration and partnership I touched on earlier.
Excellent. Yes, it does take a whole of society approach to be able to address some of the complex challenges we face. What about you, Cosmas?
Thank you. Here I have I think we should be very purposeful.
Purposeful, yes.
About kids with special needs, because very often they are left behind. And if they're in school, we can access them, but it even gets more challenging when they're out of school.
Excellent, thank you. Caitlin?
From Luminos, I think we'd leave a simple message, which is feed all the kids. Feed them all. That's how we'll reach the most vulnerable.
And Don, you get to have the last word.
Okay, well, of course, I agree with everything, but the idea of how we raise young people should be the way we think about it as parents. You know, it's something we have to do all the way through until they're adults. It's not something you just do at one point in the process. So the first 1,000 days, the early child development, the education, the school meals, these are all a necessary part of one continuous process.
Excellent. Thank you so much, panelists, for this excellent discussion today. And I want to end this session by, again, acknowledging the children who are in the room. How did we do, guys? Excellent. It was great. It was excellent. Double thumbs up. Thank you. Let's not forget that, you know, whatever we're trying to do for the child, let's involve them now, because I have seen so many examples of children already taking leadership now in addressing some of the challenges they face. But also let's not forget to partner with each other regardless of whatever sector we come from. Everyone has something to contribute. And we need to be creative in the types of partnerships we build. Thank you so much, all of you, for being part of this.